Hello everyone, welcome to a new module on infectious diseases. So, first of all, I would like to give you a bird's eye view about how you should approach the chapter of infectious diseases in pathology. See, because infectious diseases in the chapter which is mentioned in Robbins, it is actually a summary of the whole microbiology that you are reading in your second year MBBS. Fine? Yes. So, in the upcoming videos, what I am going to focus is on some important diseases which has some characteristic pathological features, which has some complex pathogenetic mechanisms, okay, which include some of the viral, bacterial, protozoal infections. So I will restrict myself only to those diseases, and these diseases are the ones you will get lot of clinical case scenario based questions in your paper 1 or paper 2, whatever it may be, of your prof exams. Fine? Yes. So these are the various chapters, okay? These are the various topics which is mentioned in the chapter of infectious diseases. Out of that, the root entry, okay, that is how microorganism cause diseases. Almost everything of this we have already studied in immunology. Fine. Then about the various host pathogen interactions. Fine. Then the first topic what I am going to discuss is the spectrum of inflammatory response to infection. That may be asked as a short note question, and a very good knowledge about this topic is important, so that whenever you came to hear about any infectious organism, you can guess how this organism would have caused a disease in that host. Fine? Yes. And as far as viral infections are concerned, I am going to stress myself on measles. Okay? I am going to stress myself on measles. Then viral hemorrhagic fever and Zika virus. Fine? And next, herpes, varicella, cytomegalo, and Epstein-Barr virus. In bacterial infections, I am going to mainly focus on Neisseria infections, okay, and tuberculosis, then leprosy, okay. Then spirochetes, I am going to focus on syphilis. Then chlamydial infections, everything in depth you are reading in microbiology. So if you get any questions, since you are studying micro in detail, okay, suppose if they make any case scenarios also, you can find the answer and you can write what the clinical features, the manifestations, okay, the microscopic findings, everything what you are reading from microbiology, you can read it. But those which I am highlighted, no, there are some exclusive pathology. There are some things which is mentioned only in pathology textbook. So I am going to discuss only those diseases. Fine. And next is what I am going to discuss is malaria, because malaria, it is one of the most because all we have lot of districts in the South India which are many endemic to malaria. So of course malaria has to be properly discussed from pathology point of view. Okay, and next we will be discussing of course about Chagas disease and leishmaniasis. Fine. And finally filariasis. Okay, filariasis. So these are important things that we will be discussing, and at last we will be discussing a word about the emerging infectious diseases and the special techniques for diagnosing the infectious diseases. Of course you will read in depth, and I also request please go through the topics like bioterrorism, sterilization, okay, then sexually transmitted infections, everything from microbiology, okay, like because we have gonorrhea, syphilis, everything it is in depth, okay, we have primary, secondary, tertiary stages of syphilis, everything is discussed in detail in your microbiology textbook. So please go and refer. So in this video, I'm going to start, it's an introduction video to infectious diseases. So there are some important tables in Robbins. Please focus only on this table. I don't want you to sit and read each and every line of the chapter infectious diseases. Okay, please focus on the tables what I am discussing here. Go and revise that, because with this table itself you can write whatever questions from this region. Fine. Okay, so the first thing what I want to discuss is what are the roots of microbial infection. For example, skin. Okay, we have skin. Okay, skin. And we have epidermal barrier. Okay, so in skin we have the epidermal barrier, that is the major local defense. And whenever there is a mechanical defect, okay, what will happen? What are the possible microorganisms which may enter the body through this mechanical defect? Answer is Staphylococcus aureus, Candida albicans, and Pseudomonas aeruginosa. Then needle stick injury. Already you know that two viruses, one is human immunodeficiency viruses and another one is hepatitis B and C viruses. Then arthropods and animal bites, we have yellow fever, plague, Lyme disease, malaria and rabies. Please remember these names, so that when I discuss, suppose I am going to discuss malaria, you will understand, yes. So how this organism, how is the malarial parasite is going to enter in our body? Through the by breaking the epidermal barrier which is located in the skin. So you will get, you can very easily you will get an idea, okay, because before going to discuss each of the infectious diseases, you should know, okay, how these organisms are going to enter in body, what type of inflammatory reactions they are going to produce within our body. So these two prior knowledge is very important, so that because that is the basic pathogenesis, okay, mechanism for all the infections, fine, or all the diseases. Then direct penetration, we have schistosoma. Then we have what we call it as gastrointestinal tract. Again, in gastrointestinal tract, we have epithelial barrier. Okay, in epithelial barrier, that too via attachment and local proliferation of microbes, we have Vibrio cholera and Giardia. Okay, Giardia. And then attachment and local invasion of microbes, we have Shigella, Salmonella, and Campylobacter. Okay, and even some of the Shigella species, they are mainly entering by M cells. M cells are nothing else but the micro fold cells. Okay, what is yes, yeah, M cells are called as the microfold cells, which are nothing else than some specialized cells which do not have microvilli, which are located in the Peyer's patches of the ileum. Then we have the acidic secretions. We have some protozoans and helminths which have some acid resistant cyst. Then next is what we call it as bile and pancreatic enzymes. Okay, we have hepatitis A, rotavirus and norovirus. All these are having some external coat. Okay, it has some external coat. This protects these bacteria and viruses from bile and pancreatic enzymes. Okay, and use of broad spectrum antibiotics, okay, leads to Clostridium difficile. Okay, don't worry, we will discuss each and everything. Okay, important points, we won't, I'm not going to miss any important points as well as for solving a MCQ. So I tried to cover almost all the points, onliners, everything I am going to cover. Okay, but only some specific diseases I am going to discuss in details. Fine. Then in respiratory tract, mucociliary clearance by ciliary paralysis, influenza, Haemophilus influenza, Mycoplasma, Bordetella, resident alveolar macrophages, the Mycobacterium tuberculosis, which is the culprit for causing the TB. India is called as the TB capital. Fine. Yes, the Mycobacterium tuberculosis is such a virulent bacteria that it is resistant to the attack of phagocytes. Then urogenital tract, we have E. coli. That is the most common cause of E. coli. Has some what we call it as fimbriae and pilae. The fimbriae that helps in attachment to the urinary tract, and that is why E. coli is the most common cause of urinary tract infection. Then Candida causes what? Vaginal candidiasis. Then even Neisseria, herpes, syphilis, all these, they can they will break the intact epidermal or epithelial barrier. All these are sexually transmitted infections. Then coming into the mechanisms of antigenic variations. Okay, yes, what are the various mechanisms? Okay, you can write this. You can write these points in your short notes or in essays if they ask you. So high mutation rate. High mutation rate, we have human immunodeficiency virus which causes AIDS and influenza virus which causes influenza. Then we have genetic reassortment. See, genetic reassortment, it is most commonly used by influenza virus. Of course, rotavirus. This has been asked as an MCQ few years back in a PG entrance exam. Okay, in which of the following organisms exhibit genetic reassortment as a mechanism of antigenic variation, except they are in that rotavirus also, but most of us don't know that rotavirus also exhibits genetic reassortment, but it is a straight table from Robbins. Okay, it causes diarrhea. Influenza virus causes influenza. Genetic rearrangement, that means via gene recombination, we have Borrelia, Neisseria, Trypanosoma, Plasmodium. Okay, all these are very, very important. Please remember all these bacteria name. Borrelia causes Lyme's disease, Neisseria gonorrhea causes gonorrhea. Then Trypanosoma brucei causes African sleeping sickness, and Plasmodium falciparum causes malaria. Then large diversity of serotypes. Okay, that is rhinovirus. We have lot of serotypes for rhinoviruses. Okay, that is why we will get common cold every time. Suppose I get a common cold now, again I will be exposed to rhinovirus, because already my body will be having immunity only to that particular serotype of rhinovirus. But each time I will be exposed to new serotypes of rhinovirus. So each time I will get common cold again and again. Okay, that is because of large diversity of serotypes. Okay, and Streptococcus pneumoniae causes pneumonia and meningitis. Okay. Then the last table, okay, in the introduction part that I want to mention here is the spectrum of inflammatory responses to infections. So we have 6 patterns of infections. We have six patterns? Number 1, 2, 3, 4, 5, and 6. What is suppurative? First type of inflammatory response is suppurative or purulent infection. Already we have studied, this is one of the morphological patterns of inflammation that I have discussed in chapter 3, inflammation. So suppurative infection means by increased permeability, vascular permeability, neutrophilic infiltration, chemoattractants, and finally suppuration means what? Pus. Am I right? So this is most commonly by pneumonia, Staph aureus, and abscess by Staph species. Okay, and anaerobic bacteria. Then mononuclear granulomatous inflammation. It by mononuclear cell infiltrate, cell-mediated immunity, formation of granuloma. Yes, you know what is the type of granuloma in syphilis? Yes, anybody? Can you remember? Yes. Yes. Okay. What is the type of granuloma? It is gummatous. Tuberculosis, it is Langerhans giant cell. Okay, Langerhans giant cell with a caseating granuloma. Caseating means cheese-like because of the mycolic acid which is present in the wall of Mycobacterium tuberculosis. It produces cheese-like. Okay, granuloma. Then third one is cytopathic and cytoproliferative reaction. See, whenever you heard the word cytopathic or cytoproliferative reaction, you have to always remember about virus. Okay, viral transformation of the cells like cervical cancer, human papilloma virus, or chickenpox and shingles, herpes. All these mainly what produces this cytopathic type of response. Tissue necrosis, that is lysis. That is mainly by gangrene, Clostridium perfringens, and hepatitis B. Then chronic inflammation or scarring, that is finally leads to fibrosis. It is chronic hepatitis. Chronic hepatitis is caused by hepatitis B and C, that is responsible for causing lung fibrosis and lung finally cirrhosis. Then no reaction, that is immunocompromised. What are they? Mycobacterium ovum. In AIDS patient, I told you, the TB produces caseating granuloma. I am asking you a question, whether this caseating granuloma will be seen in a patient who have AIDS later diagnosed with the TB? Answer is no. Fine. What is the reason for that granuloma formation? What is the basic behind that? Yes, it is the cell-mediated immunity. In AIDS, he is an immunocompromised patient. How his immunity will work? So there won't be any granuloma formation. Similarly, in AIDS patient, there will be, I can say that in AIDS patient, rather than TB, they may even get, very, very low CD4 count, like less than 300, less than 200 CD4 count. They may get Mycobacterium avium intercellulare. Okay, intercellulare, MAC. MAC is the one which is the group of, it is a type of atypical non-tubercular mycobacterium. Fine, that you will learn in microbiology. And even in, mucormycosis is seen in bone marrow transplant patients. Bone marrow transplant patients, long steroid therapies, all this, they are immunosuppressed. In immunosuppressed, there won't be any reaction. So I hope so these are the 3 important tables you have to remember in the introduction chapter to infectious diseases. Fine, please go through this table, because when they ask you, suppose for example they are asking you syphilis, so you don't know, you will write syphilis. Okay, etiology, it is caused by Treponema pallidum, so and so are the features of bacteria. Then next you will be putting the heading, what is that? Pathogenesis. So pathogenesis, what you will write at that time? You can't sit and write what syphilis will do in each and every cell. No, already syphilis made the pattern is mononuclear granulomatous inflammation. Already the pathway for granulomatous inflammation. You are going to write in the form of flowchart. Finish. Then you will go for the clinical manifestation, primary, secondary, that you have already learned in your microbiology, that you will fill it up. Again you will come to pathology. I will be discussing in the upcoming video what are the characteristic histopathological features caused by syphilis in various organs. That you will go into add up. That's it. So infectious disease chapter, as far as path is concerned, it is very easy. You should just know the clinical features so that you can find the correct diagnosis from the case scenario. And the second thing is that you should know in extra about the clinical features. You should know so that you can find correct diagnosis for the case scenario. And the second thing is that you have to know the histopathological features. Okay, in each organ, what will be the for example, gummatous lesions are a characteristic features of syphilis. Tuberculosis produces characteristic caseating granuloma. So you will write Langerhans giant cell, everything. So this is how you have to approach the chapter of infection. Don't consider this chapter as an isolated chapter. Please try to integrate your knowledge from microbiology. Okay, the bacterial, protozoal, all infection. But as far as some diseases are concerned, for example, cytomegalovirus, then herpes simplex and varicella zoster, then tuberculosis. Tuberculosis is the very thing. Tuberculosis can be asked as an essay, okay, in path. Okay, at that time you can't write something from micro. At that time you have to explain everything on the basis of the pathology only. So that and all in upcoming videos I will be discussing. And the next thing is that what is about our malaria. Malaria is a very frequently asked. Okay, they will give a case scenario, a patient coming with a history of chills and rigor. Okay, and the blood examination shows what to say, fragmented RBCs or like hemolysis, definitely you have to suspect malaria. Then malaria, again you have to write the pathology, okay, the pathogenesis mechanism, everything. So I hope this session has been useful. This session has been an introduction, okay, an introduction to approach to infectious diseases. So hope you have this session has been useful for all of you. Thank you.